As part of the NHS goals for 2025, all GP surgeries are advised to switch from the traditional phone operated booking system to a total triage system. Total triage is a new approach recommended by NHS England to improve accessibility to primary care services, better care to patients by providing more appropriate appointments and advice, and to make sure that this is delivered in a timely manner. The Valkyrie surgery will switch to this system on the 5th of March 2025, using an online booking form instead of the traditional phone-in booking system. The information you provide on this form will be looked at by a doctor to make sure your problem is reviewed by the right person at the right time. This will also save you time as the booking system avoids waiting in long telephone queues and having to queue at reception. To book an appointment, head to our webpage by searching the Valkyrie surgery. Select the home page. Once you have reached our website, scroll down and click on Contact Us Online. This will take you to the correct web page. If you have System Online or an NHS account, you can log in to make a booking more quickly. If you do not have either of these, you can still make an appointment with the links below, depending on what your problem is. You can request an appointment to discuss a new problem and common conditions are listed, or to get further information about an existing condition, a follow-up to a recent appointment, a yearly health review, for example, diabetes or asthma, a medication query, for example, a change in medication, or any other medical requests. You can also request help for things that do not require an appointment. You can request a doctor's letter, request fit notes, sometimes called sick notes, request new prescriptions for medication not taken regularly or showing on your repeat medication on the app, ask for your recent test results if they are not available on your app, or any other administrative requests. For this demonstration on a new condition, click on New Condition. Then select what type of symptoms you want to discuss. For this demonstration, I will click on Ear Problem. After this, we come to a warning screen. Some problems need to be seen immediately and cannot wait for a GP appointment. It is very important to read carefully through this screen. If you or the person you are booking for are experiencing any of the problems on this screen, stop the booking process and dial 999 immediately, or use the link at the bottom of the text box if you are deaf and would prefer the British Sign Language or text relay. In this case, I have read through this page and I do not have any of the problems listed. I will click Continue. I have none of these at the bottom of the page. Based on the category of symptoms you selected, you will then be asked several questions to give us more information. Answering these questions in as much detail will give us more information so that your problem is seen at the right time by the right person. At the bottom of the screen, you can also let us know if you want to see someone who speaks your first language, or you require an interpreter at this point, or there is anything else you are worried about. After putting in as much information as you can, Click on the Next button at the bottom of the screen. Remember, the more information you provide, we can quickly make sure you are seen by the right person. You will then be asked some information about yourself so we can find your patient record on and contact you for your appointment. At the top of the screen, select if you are the patient, a healthcare professional, or a friend or family or someone else. Don't worry if you do not know all of the information. Generally, we only need your name, date of birth, and address in most cases. Then select your preferred communication method, either email or telephone, and provide us with an up-to-date telephone number. Supply your postcode and search for your address. Once this is completed, you can submit your request. Once your form has been submitted, a doctor will review your form. They will then decide how urgent your request is. We will contact you either by telephone, text message, or email. If the doctor wishes to see you face to face, we will either send you a link to book an appointment online, call you to book an appointment, or direct you to the pharmacy for a medication collection. You can contact the surgery on 01 702 221 622. If you do not have internet access, tablets will be available to complete your form in the reception. Friends, family, and carers can fill the forms in on your behalf. We will contact you directly unless otherwise stated. Before completing your request, please use your local pharmacy who may be able to help you initially. Please remember, the surgery is not an emergency service. If you have an emergency, please contact 999, attend your nearest A&E, or call the 111 service. If you have a medication query, please complete a form. These will automatically be directed to a clinician and cannot be dealt with over the phone by the prescriptions team. The following forms are available on the website: a new condition and a list of common conditions are available, an existing condition, a follow-up to a previous appointment, a health review such as diabetes or asthma, a medication query, or any other medical request. We will also require forms completed for administrative requests for the following: a doctor's letter, a fit note or sick note, a medication request for medication not regularly requested, test results, or any other administration requests. This presentation covers how to make bookings and contact through the new Total Triage online service. If you have online access, please use this service before you come to the surgery or contact us by telephone. Nursing appointments can be booked at reception. Text messages and emails will be sent out to all patients in the coming weeks. We look forward to working with you and improving our service.